Okay, it is top of the hour, so let's get started. So I am honored to introduce two of our leaders in education. You all know them. Still, I'll give a little bit of a CV. So as we know, why don't we start with Dr. Sowar? Dr. Sowar is our residency training program director, and she has done a terrific job in many ways. Our class has grown. We have extended new rotations. We're working on a rural program in Las Cruces and another one in Vegas. So a lot of work that has been done by Dr. Sowar. So Dr. Sowar is trained in child psychiatry with us, and also in general psychiatry and residency in medical school in Colorado. Now, undergrad, she started at Yale, and I'm always very impressed that she played basketball there. So she was, I don't know if it's Division I or II. Anyway, you should be proud of yourself, Dr. Sowar. And then moved to University of Colorado, finished her college there, and then, as mentioned, medical school. Now, Dr. Varela, as you are all aware, recently joined us, and he is the Vice Chair of Education. And I think he is, the first Vice Chair of Education who's not an MD in our department. And he comes from Sam Houston University, where he was training director, chairperson. He was there for 17 years. Dr. Varela also had a distinguished career in the military. And he's the director of the postdoctoral internship for psychology. And he's been working on actually expanding our postdoc positions, and then have positions that we within the internship and the postdoc. And as we know, the department is working in actually expanding our training of other disciplines. We are, of course, a multidisciplinary field. And so we have now the School of Social Work that will grow here, and eventually it'll become a School of Social Work. Dr. Varela is overseeing that. And we're also working on getting a residency for pharmacists in psychiatry and substance use disorder. So we are honored again to introduce you both. And the topic is about education. So let's get started, folks.
Great. Thanks so much, Dr. Towen. Thanks for the introduction. Okay, hi everyone. It's great to be with you today. So I'm looking forward to spending some time at the start, providing a kind of an overview and update on our psychiatry residency training. And that will link in with, as Dr. Towen mentioned, some of our expansion considerations and some of our tracks. In the past, we've done, we've tried to do a grand rounds where we talk a little bit about the residency and we spend kind of a short amount of time with each of our fellowships, but I think this year we wanted to shift it just so that everyone has a little bit more time and space. So so I'll start by talking about the residency, and then I'll be happy to hand it over to Dr. Varela to discuss more about his role as Vice Chair of Education and more so into the psychology internship. So let me go ahead and share some slides with you all here. Okay. Okay. There we go. Okay. So in terms of objectives, and just to frame at the start also, this is not a CME grand round. So in terms of the, kind of content that we fill out at the end, that does not apply to today's session. So we'll just talk about some updates and kind of overview of the evolution of the residency, and also talk more about some of the both areas of growth and area of needs for us. So especially for those of you as faculty who are involved, just a little bit more discussion about where we're hoping to grow and continue to incorporate more faculty support. And then again, we'll hand it to Dr. Varela in the latter part. So I just wanted to frame with kind of revisiting what our goals and mission are for the residency. And we actually have several aims that we have identified out as well. Those are in our handbook and on the website, but I just kind of wanted to provide the overarching mission reflection again, which I think is helpful, as we're doing programming and as we're recruiting and really thinking about how what our intentions are day to day with the program. So we think about our primary purpose of the psychiatry residency as providing outstanding education and training for our residents. And as many of us know here, I think in New Mexico at UNM for many years, we've had a goal at training and supporting the training for individuals so that they can be adept at serving both the demographic and socioeconomic needs of New Mexico, but also so that people feel very capable and confident of leaving their training here and being able to practice in, a wide range of other settings, which might include, subspecialty, might include working in community health centers, and that could be in other national or international areas. And then we're always happy to support people pursuing their individual interests and fellowships. And so we really think about how do we provide a well-rounded balance of neurobiological, epidemiological, psychological, and sociocultural aspects of psychiatry. So I think it's always helpful to anchor back into what our vision is. Just wanted to start with that. Okay, so I wanted to frame in terms of the size of our residency, as Dr. Tohen mentioned, we have expanded. So we moved to an approved residency size of 64 about 2 years ago. So what that means is that through ACGME, like the overall governing body of our psychiatry residency training, we can train up to 74 residents at a time in the program. And then we also have funding to support the training of 64 people at once. So I just wanted to share what that means for us in terms of the breakdown, though, of where we have funding. So we actually have a pretty large pool of funding at the VA Medical Center here in Albuquerque. So 16, if we think about 64 residents, which means effectively 64 kind of FTE to cover, 16, a quarter of that are actually located through our VA Medical Center. So our interns spend, a good majority of their time at the VA, and then we have some additional rotations in our second year. But this has been a space that we appreciate the collaboration with VA leadership as we continue to determine, how can we support some of the additional training needs through our VA Medical Center in terms of funding. We also have additional funding from the state, and so this helps support rural rotations that we offer, for example, at the New Mexico Behavioral Health Institute, some of the other kind of elective opportunities in the state that individuals have. And then we have, as of this year, some additional FTE that's back at Sandoval Regional Medical Center. And so with a lot of gratitude to Dr. Tarani for her work there, we have the opportunity to have residents spend more time at SRMC. So then all the rest of our funding and time for residents is split here at UNM and divided between rotations within the main hospital at UPC, which includes PS, and then also at CPH. So in this current class, this current year, we have 59 residents, and next year we're anticipating actually being closer to 63 just in terms of sort of movement within the program. Just to clarify, each year we have residents who leave after the third year of training to go into child psychiatry fellowship. So this past year, we had 5 residents who chose to pursue a child fellowship after third year. So that sort of explains the numbers if we match 16 each year, why we don't quite have a full 64. Okay, so then in terms of structure for our training, so as a quick reminder, psychiatry being a 4-year residency program, we do offer here as well a child track, but in general, psychiatry residents have the option of multiple fellowships, but child is the one that currently people can fast track, meaning that after 3 years of general residency, they can pursue the fellowship. Other fellowships are post the 4-year training. So our residents, their intern year is a mix of medicine and neurology requirements, which is a total of 6 months through the year. And then they are otherwise largely based at the VA, but our interns do a month at the new PES Crisis Triage Center, hopefully to give some context for working in that setting. And then also at our university consult liaison team. And our PGY2 year is a heavy year in terms of inpatient service coverage between adult, geriatric, and child psychiatry. So lots of acuity, lots of hopefully depth of learning in those spaces. They also spend a couple months doing consult liaison work as well as PES. There is a 1 month selective opportunity for people to choose, what they want to kind of delve more into or spend more time as an independent choice as a second year. And then we also have a float rotation that helps with coverage for leave on inpatient units. Our third year is a 12-month outpatient, so it's all continuity, and that is largely based here at UNM. But again, we continue to expand. This year we are adding, and thanks to Dr. Kanaka for his work with this, but we did add a new outpatient IHS-based opportunity for people, and we're continuing to work on the third year outpatient opportunities. And then our fourth year rotation, so of course we have chief residents who dedicate a tremendous amount of effort and time towards our program during fourth year. We also have a lot of other elective opportunities that people have traditionally pursued during fourth year. So that's some of the structure. Leadership. So I feel it's certainly a privilege, and I'm very grateful to be in the program directorship role. I think I'm now just turning the clock on 3 years, a little more than 3 years. But very fortunate that we've had a lot of commitment from the individuals who are named here as far as our associate program director team. With such a big residency, especially where we're at multiple locations, it's really critical that we have additional support throughout those sites. So just to frame here, so Dr. Armijo is our senior associate program director in terms of her amount of protected time. She works mostly with our PGY3 class, but also does other programmatic work that I'll talk more about. Dr. Romero is centered for our second year residents and does a lot of work in UPC PES. Dr. Mertuza is focused primarily on child and the child track. And then we have two, Dr. Abeda and Dr. Vallone, who are both at the VA. And then we added Dr. Crawford, Jennifer Crawford this year, which was really exciting in terms of the first time that we've had a psychologist as part of the program directorship team. And she focuses both on the interdisciplinary, interprofessional collaboration, as well as psychotherapy. And then Dr. Kilgore, who works with our fourth years and in psychotherapy as well. So as you can see, we have these all kind of divided into locations and areas of expertise. And then just a note here, so I think many of you know that Judith Rivera Camps, who has been our program manager for many years and here at UNM for many more, is going to be transitioning at the end of September. So I just wanted to express a tremendous amount of gratitude to Judith. She has done so much for our program over the years. Lorraine Koleski is our program coordinator and certainly coordinates many arms of what happens day to day in the residency. And then Sarah Rodriguez and Carla Tavares, again, both do so much in terms of our administrative work. So just wanted to make sure to thank them for their efforts day in and day out. And then core faculty. So we did have a core faculty meeting recently. I just wanted to frame. So any residency program, you have program leadership in terms of program directors or associate program directors, but then also you're required to have core faculty. And here I shared the description of what ACGME defines a core faculty member as. So it's someone who has a significant role in the education and supervision of residents and devotes a significant portion of their effort to resident education and or administration. And they teach and or evaluate and provide formative feedback to residents. So we have a little over 20 core faculty in our residency. And I just wanted to put a little ask here, which is that if you believe that you are fulfilling the duties of a core faculty and have not had communication from us accordingly, please let me know. Please reach out, because we want to make sure that we're recognizing people And if you are core faculty, of course, and this is something that maybe doesn't feel like it fits quite as much at this point in time, we're always updating this current list. Okay, and then chief residents. So again, here, kind of in parallel to our associate program directors, we have multiple chief residents. As you can see, I've named them by primarily their year of residence that they work with, and location. And then as well, we have psychotherapy, addiction, consult liaison, and rural community chiefs this year. So again, just wanted to thank each and every one of our chief residents. I think they really help our program and in many ways keep the day-to-day running and provide a lot of mentorship for our residents in each year as well. So thank you. And it's always something that we look forward to talking about and brainstorming for the next year's class of chiefs as well. Okay, so now I'll start moving a little bit more into content. So all residencies have to have two governing bodies. So one is a program evaluation committee, and this is a program, or I'm sorry, this is a committee whose main focus is really to support the ongoing evaluation of the program in terms of what kind of educational content we're delivering, responding to our ACGME or other relevant surveys, reviewing board pass results and some of our in-service training exams, and just thinking about, okay, like in the different dimensions of what we're delivering as a residency, where can we continue to evolve? So we have several residents involved. We're always open to have faculty as part of our program evaluation committee. This committee meets quarterly for about 2 hours at a time. So if you're someone who'd be interested in being involved, again, please let us know. But Dr. Armijo is the chair for this committee. And then our residency clinical competency committee, this is the other kind of required governing body for our residency. So this is the committee that, first of all, is responsible for reviewing all of the residency evaluations each semester and helping generate a collective what we call milestone reviews. So it is kind of compiling evaluations and other feedback that comes in to kind of provide residents with a reflection of how they're doing at that point in time, including on the numerical evaluative scoring rubric that we use. And then the clinical competency committee is also the one that's responsible for tracking and supporting the academic and clinical and professional development of all of our residents. So sometimes if an individual is struggling or needs support in any of those areas, the clinical competency committee is largely responsible for reviewing and creating recommendations accordingly. Okay, so some changes that we've had in the past few years. Didactics, sometimes we've tabulated the number of hours of didactics that we have. So given that we do about 4 hours a week and we have 4 classes that often have didactics separately through the year, if you calculate that, that's a lot of hours of teaching. And so we're always really grateful for our faculty who are teaching. But just in terms of a quick review, so we did migrate our residency didactics this year to Wednesday afternoon from Wednesday morning, where they had been at for many years. And that was for a few reasons, and one that we're hoping also improves the fluidity of attendance for residents. And it's just something I think this year we're really continuing to track in terms of how that's been going. All of our didactics are back in person as well, with kind of less common exceptions. And then our policy for attendance is currently that our residents need to attend 80% of didactics to kind of obtain credit for that. And in terms of our benchmark, like our requirement expectation as a program, ACGME has an expectation of 70% for residents to attend for graduation. But, I think this is one space that's been an ongoing conversation for us and really supporting like an enriched learning environment. I shared here some of the content threads that have continued to grow over the past couple of years. And certainly I wanted to thank Dr. Dominique Price and Adrienne Anzaldua for their work last year in growing a lot of this out. But so we have both for our first and second years, we have substantial amount of time that goes into a patient interview curriculum. Dr. Bolton for first years and Dr. Bustillo for second years really are taking the helm. We also have a cultural psychiatry thread and a forensic psychiatry thread. So that's been great to help build out more of our forensic knowledge base for the residents. Dr. Arciniegas, David Arciniegas provides a neuropsychiatry curriculum with some of our other faculty with expertise in this area. And then as you can see, I did list cultural psychiatry twice, it's important, but you can see the other threads that we've listed here. RTR is a resident teaching resident where we have a little bit more focus on resident experience as educators during didactics. And then we have residency houses where the residents meet monthly in a group, which is kind of mixed throughout years. So first through fourth year residents are together with a faculty mentor. And we have particular topics that we have continued to be working on, like what would be particularly valuable to share or reflect upon in those spaces. So in terms of where we're currently at, this Friday afternoon Grand Rounds piece, we feel like is such a meaningful learning opportunity. And we're really working on like how to create the space that this is protected for residents and across all 4 years, but just that we're really encouraging the attendance for people to be here for the learning. And then, I think with the continued growth in terms of technology and virtual landscapes, et cetera, and post-COVID, thinking about how can we capitalize on aspects of asynchronous learning for residents, which might include, can we have content available at the start of each rotation that's particularly pertinent to that rotation? Just kind of where we can be more creative with asynchronous options as well. Another area that we've evolved, and as mentioned, Dr. Crawford and Dr. Kilgore have been very involved in this area, but previously as a residency, we had expectations for our third and fourth years who were training in psychotherapy around the number of cases or the number of patients, basically, I think clients that they needed to see each year. But I think ultimately that was feeling like not the most clear to track or to understand really how much experience or depth that each resident was gaining. So we did move this year to parallel other residency programs nationally where we've made it now hour-based expectations. So our third year and our fourth year residents have an expectation of how many hours of therapy, how many hours of supervision in both cognitive behavioral therapy and psychodynamic training that we want them to be doing. Still at this point, I think we're still ironing out the transition there, but we are really hopeful that this system will create a better space to support and hopefully evaluate that learning experience for residents. We start with psychotherapy didactics for our second years, and then our third years technically can start doing therapy, and third year is also when they start with their more formal supervision groups as well. So the one ask I wanted to put out is if anyone here is not signed up as a psychodynamic therapy supervisor, this is a space that we can always, and especially now, would benefit from having more supervisors. So if it's something you'd be interested in, even if it's working with one resident, that would be great. And again, here at the end, I'll kind of collectively summarize some of our primary kind of asks at this point as a residency. Okay, so I wanted to transition just to talk about within, our bigger program where we have some smaller tracks for residents in terms of their subspecialty interests. So the first are research tracks. So Dr. Crisanti oversees and has really helped create the expectations and flow. So this is designed to support residents who have a clear goal that they want to become physician scientists. They really want to have research as a substantial part of their career post-training. So what we've created is an application or an opportunity for interns to apply to the research track by the end of their intern year, and then they'll be selected around the start of their second year. We do provide some additional protected time for our second years, more so for our third years. And then the vision is that residents on the research track will dedicate more of their fourth year to research. And so there's both the time, but also really the consideration of what kind of additional mentorship and support that people on the track will receive, both in terms of creating a proposal, working through and thinking through applications for grants, and just hopefully developing that early mentorship towards a career in research. So we look forward to continuing to see how this grows out over the next few years. And then, as mentioned at the start, we do have a separate child and adolescent psychiatry track. So UNM is one of a few programs nationally, or a handful of programs nationally, that has a separate track that people can match into separately when they're coming into intern year. So when people apply to our program, they can apply to the general residency track, which is 13 positions, or they can apply to the child track, which is 3 positions. They're kind of separate. Of course, the training for our general and our child track residents looks very similar, and everyone's together in the same cohort. But our goal is really to help support individuals who know coming into residency that they want to do child psychiatry fellowship and ideally pursue a career working with kids and adolescents, that they'll have some additional protected time as well for child psychiatry training. And then some additional kind of interest hours or connection within our child division as part of their early training. I think sometimes we've heard historically that people may enter residency with an interest or desire to do child psychiatry, and then the first couple of years of our program are pretty heavy in other adult settings, but not as much time in child. And so what we had received feedback was, people that were interested in child sometimes felt like they lost that connection in the first 2 years. So that's part of the track goal, is to help provide more of that connection and mentorship as people are journeying through the 3 years of training. Okay, so just a few additional updates that I wanted to share, hopefully will be helpful for those of you who may have residents who rotate with you or just in general. So I would say over the past couple of years, there has been really an increase in terms of the supervision or oversight, I should say, kind of oversight and monitoring of the rotations that we offer to our residents, in terms of both making sure that everything is aligned institutionally between necessary agreements that we have to have between sites, that we have a clear site director who's been named, and also that we have funding. So unfortunately, we have had some rotations that in the past that we've been able to offer that currently we aren't able to offer because of one of these variables not being present. Either we don't have the funding, or we don't have the other kind of documentation in the place that it needs to be. So we are hoping for many of these that they will come back online over the next year or two. But just to share, if sometimes we have people reach out and say, oh, could we have our residents rotate at this really great community site? And just to reflect, we'd love to explore opportunities, but there are these different kind of procedural steps that we have to take to make that possible. So the second is, I talked about the residency houses, these meetings that are within classes each month in didactics. And again, we have several faculty who are serving as mentors in those houses, so thank you for your time. We have tried to shift the focus this year to discussions around professionalism and professional identity development. I think there's so much there in terms of just growing into the role and identity of a physician and psychiatrist, and various things that come up, right? Considerations about social media use, considerations about other things that can be a really important conversation that we have with patients or part of our practice, but may not be something that traditionally has fallen into the standard didactic curriculum. So that's another area of growth. And then, as I mentioned at the start, we have a lot of funding at our VA Medical Center. We're continuing to work on opportunities to expand training or take advantage of some of the unique subspecialty offerings at the VA. We also this year have just created a new first-year rotation for our interns, where they will also serve as a float to help cover sick leave at the VA. So we're hoping that this will kind of be helpful for sustainability. And then finally, I just wanted to mention for our 4th year, so we have added, 4th year in the past has been largely elective. We have really continued to sit with how do we support people pursuing what they're most interested in during fourth year, and also how do we continue to think about what kind of structure is most helpful to make that possible. So we continue to talk about our fourth year. I know we've had ongoing conversations about we'd really like to help support interested fourth years to also have more time either at ASAP or doing more addictions work as well. So I'm sure more to come in terms of updates for our fourth year residents, in addition, again, to those that choose to chief and do a significant amount of administrative and education work. Okay, so expansion opportunities. We have talked about Doña Ana County in a few different, probably a few different settings over the past year or two. So this is a planned expansion project in Las Cruces and in the surrounding county that will, the anticipated plan is it will be a 1+3 track. So the goal is really that this will be centered in Las Cruces, and the interns will do their first year with us here at UNM in order to gain exposure to areas that they may not otherwise have the same opportunity in Las Cruces. But then their subsequent 3 years will really be in the community in Las Cruces and working at some of the different hospitals and sites there. So I think it's really, exciting, especially for that part of the state, and thinking about how we support training and hopefully retention of more psychiatrists in that area. Dr. Kanaka will be the program director, and so there's just still a lot of the preliminary work that's happening in that space. And then a newer opportunity that we've been talking about is in San Miguel County, which is the Las Vegas, New Mexico area. And as we talked about NMBHI, the state hospital is there, but there are some other unique training opportunities in and around Las Vegas. And so we've been exploring if we might be able to create a track where residents could spend perhaps a year or more in Las Vegas. And so that's kind of a continuing work in progress at this point in time. Okay, so I just have a couple of slides left. I think in terms of where we are seeing like growth opportunities and where we're also feeling a little bit of challenge is that, with many residents and really wanting to preserve the opportunity to support people individually and, really both from a mentorship and kind of supporting individual interest and growth, but also in terms of academic and clinical performance and competency. I think this piece just feels really critical for us. Like, how do we continue to support the dedicated time and energy on behalf of our teaching faculty? So we're always, and Dr. Armijo's done a lot of work on this, gratitude to her for her mentorship thoughtfulness. But so we're always in search of, faculty who feel like they have bandwidth to do mentorship or to serve as mentors. We've been working on just like how do we continue to really evaluate residents in effective ways and provide kind of the support and education accordingly. And then, as mentioned with the houses, like thinking through concepts of professional identity formation and this part of the landscape of training, so to speak. A couple other areas of challenge are that in our psychotherapy realm, it's nice to have patients that residents can choose from in terms of psychotherapy who may be a good fit for where they are at in terms of the learning curve and capacity to, be able to get to appointments and be kind of have the accountability in that dynamic. So we're always also open to ongoing referrals or recommendations for individuals that you may be seeing in other clinics who could be good resident psychotherapy patients, and certainly could direct those to Dr. Antoine Ho, who's our fourth year chief, or Dr. Kilgore. And then just with, growth in general in the program and where we have learners from other disciplines, I think there's really ongoing evaluation of, what kind of space and kind of teaching, learning, not competition, but where are the spaces that we just really need to be mindful about trying to preserve the resident learning as much as possible. So for faculty, I just wanted to highlight, coming back here, that if you are joining as faculty, again, if you have interest and are not involved in any of these, please feel free to reach out. Between mentorship, psychotherapy supervision, Fourth year didactics and also engagement and any feedback initiatives. Those can all be super helpful. And then I'm just going to spend my last couple minutes talking about interviews and recruitment season here. Oh, actually, I have one other side, which is the evaluation. So those of you that are working with residents or residents who are evaluating faculty, just a reminder about, the new innovations, evaluations are really helpful for us. They're very meaningful in terms of, gathering data so that we can get a better sense of how people are doing in different spaces and provide that feedback to them. These are all based on the milestones that have been developed through ACGME in terms of core competencies for psychiatry residents. And, they're scaled on the level 1 to 5. Really, they're geared where, you would expect a first-year resident to be at a level 1, a second-year resident at level 2, et cetera. And so, as people complete evaluations, you can kind of scroll over and get a sense of what the kind of achievements are with each level. But yeah, I think, we've had conversations about would it be helpful for faculty sometimes to complete evaluations with the resident collaboratively, or again, just, open to thoughts that people have. But I just wanted to reiterate, we really appreciate you filling out the evaluations, especially on behalf of the competency committee and for the milestones that we generate. Okay, so as we're getting close to interview season, now that we're in September, just wanted to highlight a little bit. So in terms of the residency match nationally last year in medicine, so this is thinking about all specialties, last year was the largest match ever in terms of positions. So there were a total of 40,000 first-year resident positions that were open across all specialties. In terms of psychiatry, there are currently 404 psychiatry residency programs nationally. And this past year for 2025, or for this current class that started in 2025, there were about 2388 positions offered and only 8 unfilled nationally. So as you can tell, psychiatry has become more and more competitive. The number of positions that were offered also has increased by 25% from 2021. So like our program, programs that have expanded or new programs that have started, we're certainly seeing more psychiatry training opportunities. As mentioned, there were this number of positions offered. There were 3,200 plus applicants last year. So as you can see, many applicants did not match into psychiatry. But when we look at kind of in terms of training, 60% of psychiatry PGY1 positions were filled by US MD graduates, 22% by US DO school graduates. And then as you can see here, the division in terms of non-US IMG and US IMG. So for all of these, psychiatry is currently the 5th largest specialty match in each of these groups, which I reiterated there. So in terms of the matching numbers, we need to interview, or what's kind of published nationally is that programs need to interview about 5 candidates per spot to fill. So we recognize some programs are more competitive than others, but for us, that means with 16 positions, right, that we're ideally interviewing closer to 80 or more candidates. We usually try to get closer to 90 to 100 each year. But we will be starting interview season very soon. It kicks off in October. The primary dates are Tuesday and Friday, and then there's a couple Wednesdays and a couple other dates interspersed. We really appreciate and we would love for you to help with interviews as you have time for our faculty. Lorraine has sent a couple emails about sign up, so if you haven't had a chance to respond, if you could, even if you can do 2 interviews, that's great. If you have the bandwidth for more, that's awesome. And then for residents, being involved in the recruitment lunches is really helpful as well. So more emails will be coming about that. But yeah, that's I think most of what I wanted to cover here, and wanted to make sure then to devote the last part of this session to Dr. Varela. So Dr. Varela, I'm going to go ahead and hand it to you, and I'll stop my screen share.
Thank you, Dr. Sowar. It's certainly impressive, the psychiatry training through the residency program. A lot of things going on, and it's safe to say that the future of New Mexico psychiatry is in good hands. So I have some slides, not quite as many as Dr. Sowar, which is probably good because I don't have a lot of time, but I do want to share some about psychology training and then some about being a about vice chair. So let me get my slides going here. Um, let's see. All right. Um, Okay. Can people see my slides?
Yes.
Thank you. Um, okay. Well, again, good afternoon. I'm Jorge Varela. I am a clinical psychologist, and since June 1st, I have been a member of the faculty at UNM in our department. Um, I serve as the director of the doctoral internship program in psychology. I also serve as vice chair for education, and I spend my practice time through the Division of Forensic Behavioral Sciences. Um, as Dr. Towen said, I spent 17 years as a professor at Sam Houston State University, where I was a kind of garden variety faculty member, but then director of our PhD program, and then finally chair of the department for a few years before coming to UNM. And my route to here is a little different. I spent 9 years on active duty in the Air Force as a psychologist, and my last position was here at Kirtland Air Force Base, which is where I grew very fond of Albuquerque in New Mexico. But so let's talk about professional training in psychology. So we have a psychology internship program. It's accredited by the American Psychological Association. It's led by myself and Dr. Rachel Miller, serving as associate director. We have roughly 25 faculty members with a wide range of expertise and not and we draw interns from across the country from counseling and clinical programs with PhD and PsyD degrees. So we draw a lot of people here. We have this year we have 5 tracks. I had them listed there up at the top: clinical child psychology, early childhood, autism spectrum disorder, integrated behavioral health, and multicultural, Native American, and rural. These we have this year, we have 9 interns across these 5 tracks. Next year, we have already begun our recruiting, and next year we will be bringing back online our pediatric neuropsychology internship program and our substance use and addictions programs. And that the substance use program is very exciting because we'll be partnering with CASA on Central Campus to deliver this training opportunity. So that's what we do. We train students in accordance with our accreditation in the profession-wide competencies of clinical psychology and well, not really clinical health service psychology, which is a broader. And you can see here that includes ethics, research, intervention, assessment, multicultural, consultation, supervision, interprofessional, and then professional values. So that's we do that through a series of the didactics, and this is just a small list of the kinds of things that we cover. Of course, interventions, a lot of emphasis on delivering culturally sensitive interventions and assessment. We help our interns develop professionally as they start their careers. We have a didactic series related to training supervision and more. For example, one of the other topics we have is sports psychology. So we have a lot of things that we do to help our residents finish out their doctoral training and embark on their careers. We also, here in the Health Science Center, we have postdoctoral training. I just want to take a minute to talk about that. These are the areas that we have people training now. You can see that there's overlap between what we do in our internship in terms of content, but clinical child, integrated mental health, neuropsychology. We have postdoctoral fellows at community behavioral health. We have a postdoctoral fellow in primary care. And especially within our own department, we have our forensic psychology postdoctoral fellowship. And this year, we have 4 fellows. It's the largest group, including a new juvenile forensic fellow. So that is a part of fellowship training here at UNM that has grown considerably over the past few years. And the success of this and the reputation of the forensic work here was no small part of me being interested in coming to University of New Mexico. So, and I'm happy to talk about that, but that's just kind of summarizing the training that we do here. I'm going to stop sharing my screen now because that's my last slide. And just talk about being vice chairs. I'm honored to serve as vice chair, and I'm honored that Dr. Towen and the people involved in the selection wanted me to do this job. I see myself as I would point out that my approach to leadership in general is that of a servant leader. And so I see that my job is to support and promote and really continue any way I can the success of the training programs that we have here. Dr. Sowar doesn't need me to go talking about what to train, but anything I can do to support Dr. Sowar and the rest of the faculty that are training the residents, that's what I'm going to do, whether it's through gathering data or just talking out anything that's going on. The same thing for our psychology training programs. Dr. Towen mentioned briefly that we have a social work degree granting program coming online. The plan now, and we are on track to meet this goal, is to admit the first class of social work students in fall of 2026. And this is going to be a new experience for the department as a whole because it is a degree granting program. So there's the whole set of academic considerations and requirements, but we are ready. Jen Panhorse is serving as interim director, and she's done an outstanding job of getting the program to this point. We have a field placement director now, and we have an administrative associate. That program is being funded by I believe, $11 million endowment from the state. So we have been, of course, hearing about the financial strain of the Health Science Center and the School of Medicine, but rest assured that this program is being brought on board with money from the state because we have a shortage of mental health care providers. Social work is no exception there. And we are looking forward to doing our part to develop a workforce, not just in psychology and psychiatry, but also in social work. And soon we'll be working on developing a pharmacy training program, examining substance use disorders and psychopharmacology. So my job as a vice chair is to support all of that and to do what I can so we can continue the success we are having here. So I would invite all of you that are involved in training that if you got things that you haven't been able to address or you want some support administratively, please do not hesitate to contact me. I'm in a vice chair suite with Dr. Waldorf and Dr. Cullen. So just come bang on the door, and I am more than happy to hear what's going on and seeing what I can do. I may not always have the answers, but I can usually find them. And I know where Dr. Towen's office is, which helps. But I would love to spend the last 10 minutes that we have, maybe a slightly less than that, uh, with an open discussion. Maybe think of it as town hall or any other format, but feel free to bring up any questions that you have for us involved in education. I like to think Dr. Sowar is ready to take questions too, as well as others. So, I don't know, fire away.
Let me get started, actually. So workforce development, as I mention every time I can, we know
Yes.
that that is a priority for UNM, and we do plenty of it. I'm really proud of being part of this group. It is multidisciplinary, and that's something that we all have in common, which is to take care of our trainees. In fact, if it were not for our trainees, many of us wouldn't be here. That's what brought us here. That's what keeps us moving. That's what makes this job very rewarding. So I want to just thank again Dr. Varela and Dr. Sowar for the terrific job that they do in one of our key missions to serve our state, serve our community. Thank you, folks. So questions for our presenters today, questions or comments or words of wisdom of advice for them.
There's a question in the chat about, can we have some information on international rotation, specifically New Zealand and Guam?
Thank you. I can jump in on that briefly. Yes. Thanks, Dr. Desborn. Yes, this is something that we've been excited and grateful to offer in the past. And again, is one piece that I think funding wise, we just continue each semester, each year to kind of evaluate what's possible. But Dr. Bonham, with gratitude to Dr. Bonham, she's been very involved, and Dr. Kanaka with both of these. So yes, we can make sure that we are distributing this to everyone in terms of residency classes who might be eligible to look at international opportunities. Yeah, we can share more.
And I want to thank Dr. Waldorf for bringing up that there is a new postdoctoral fellowship in pediatric psychology at Carey Tingley and at the outpatient pediatric medical clinics. Again, just another one of the examples of the growth and the effort to develop a workforce that can address the needs of people in New Mexico and around. I think it's important to remember that no one profession is going to be able to alleviate the burden of mental illness in the US, around the world. It's going to take a lot, and it's going to take people at all different levels to do that. So we're trying to do our part here to grow that. There's a comment in the chat about the rural offerings.
Other comments, questions, folks? Words of advice.
And I can just jump in, Dr. Towen. Yeah, thank you, Dr. Matheson and Dr. McQuarrie, for your chats. Yeah, so I would say that in terms of rural health, and this is where Dr. Kanaka continues as director for us, right? Historically, we've really felt that the opportunity for residents to be connected with rural training is really meaningful, especially for individuals who may want to pursue a career in that path. This has been a space that we have encountered some challenges between the kind of required legal agreements, documentation, and funding. So we still have several open opportunities. Again, I can make sure this goes out, but it can include, for example, at Zuni Pueblo. There are, other sites, including Las Vegas, as mentioned, several others I can make sure that we send out. But I think that we had a bit of a dip in what was actually available and hopefully what is coming back online. And then for Dr. McQuarrie, I think other global health. I know that Dr. Kanaka had worked with other faculty in terms of looking at opportunities both in Mexico and in Spain. I'm not sure at this point what is most actively happening, but certainly it's something that we want to continue to pursue where it's feasible and keep everyone posted too.
Actually, residents have been to Sonora, Mexico, and there's also interest in Chile to have an exchange of learners. Any other question, folks? Comment? Well, it's always good to finish 5 minutes before the top of the hour. So we're finishing right up on time. Dr. Varela, Dr. Sowar, thanks so much for what you do for our trainees.